What have we learned since the start of the pandemic? Please give me a really succinct bullet point answer. I'm going to go in the order that is on my screen here: Vincenzo, Asma, Ray, Andrea. What have we learned since the start of the pandemic, bearing in mind the pandemic is only really 18 months old? Vincenzo.
Oh, we've learned a lot. There have been thousands and thousands of papers in pregnancy and COVID that we've learned that the virus can affect women, that women actually get worse compared to same age non-pregnant women, that again, they have more severe and critical disease and they can even die more often. We learned that the baby can be affected because the baby can be born too early if the mother is very sick, can die, can have severe consequences. I think the most important thing that we've learned is that women, pregnant women, therefore, should be even more than other adults. There are risks more than other people. They should be on the top of the pyramid to get the vaccine sooner than other people and be protected. And it should be sold, like Asma said, in terms of protecting not only them, because they don't care about themselves that much, but they care a lot about the baby. So sell them on the fact that if they stay healthy, they can protect the baby and have a much healthier baby. And in fact, if you get the vaccine during pregnancy, that protection for her and the baby can last for a long time as those antibodies get transmitted in utero.
Thank you, Vincenzo. I'm going to actually ask the same question to Asma. What have we learned since the start of the pandemic?
I'm going to give you a very short answer. We should embrace technology. We could not have carried on living and communicating the way we always did without the technology. And therefore, I think for me, I learned that I should embrace the technology and get the best out of it.
Thank you. Ray.
Well, from our perspective in Latin America, I think we have learned that we were not ready for such a pandemic and that we really needed more quality in our health services, and we need to take care of our population in order to avoid these extreme situations of more high mortality and pneumonia and things like that.
Thank you, Ray. Andrea.
Yes, we've learned a lot of things in pathophysiology, etc. But most importantly, we've learned how to cope with that, how to protect ourselves. So healthcare professionals, we've learned how to manage our patients. And now with vaccines, we have an important weapon to target this infection.
Thank you all. Excellent answers.